My name is Greg Dodell, as Mark announced. I'm from the Committee of Interns and Residents. We are an organization and a union of residents who are on the front line of healthcare every day. We see patients and their families who can't afford to get the healthcare that they deserve. In a recent regional meeting of our union, it was asked if we ever see patients who aren't able to get the care that they deserve. The crowd responded with a chuckle. It was apparent that this is something that we see multiple times a day, not just once during our early careers and training. Just one example of a patient I saw last week. I have thousands I could have chosen from, but this was a 37-year-old patient who came to the hospital in diabetic ketoacidosis. For all of you that don't know, this is a fatal condition that results from untreated and undiagnosed diabetes. When I saw this patient 24 hours into his hospitalization, he was crying. I asked him what was wrong. He said he was depressed, he didn't have health care insurance, and he didn't know how he was going to take care of himself. After trying to appease him by offering free samples and a way for him to follow up in our clinic, he still appeared down. And I asked him what else was troubling him. He said last week he had lost one of his best friends to an asthma attack. He told me his friend was at home, he started experiencing shortness of breath, and he later died from asthma. He revealed that his friend also did not have health insurance. It's not hard to fathom that maybe he was also scared for his life at this point. So this story illustrates a few crucial points that have been reiterated today. Number one, it has to be affordable. This new plan must be available for all of us, including people that don't have insurance now, including people that have insurance that aren't happy with it, and all the rest of us that are standing here today advocating for our various groups. Number two, it must focus on quality, prevention. This patient with diabetes illustrates a very important point. If he had been diagnosed earlier with his diabetic condition, he may have been prevented from long-standing complications such as kidney disease, heart failure, and everything else that goes along with diabetes. So it's very important that we focus on quality of care, not quantity. Lastly, a public option, as we've talked about here today, is very crucial. Right now, the private insurance companies really have a hold of the market, and as we all know, premiums are going up greater than inflation, 3-4 times. This is not sustainable, as we've heard from President Obama, from our congressmen, from our senators, and from everyone here today. It's very important that we have an option to create competition for private insurance companies. Lastly, our medical system now is very similar to global warming. As we stand here in the heat, we can maybe see. We're getting the symptoms of what's wrong with our healthcare system now. And if we don't do something about it, we're all going to be in for big problems later on. Lastly, I just want to reiterate that this current system now, you could be the greatest doctor in the country, but it really breeds mediocrity. And us doctors are here to support a new healthcare reform where we can all be great. Thank you. Yeah.